I'm excited to be talking today with Chris Grasso, a healthcare tech executive with over 30 years of experience in areas like building organizational capacity and strategic planning and system design. Chris has worked in a federally qualified health center setting for 20 years, where she led large-scale tech initiatives and product delivery by engaging the key stakeholders and effectively managing the institutional change process. My experience working with Chris has been that she's an early adopter of technology, and she also has the experience to align technology with organizations' strategic and operational goals. In her current endeavor, she serves as the co-founder of FASTx Partners, which provides part-time or on-demand fractional executive services in areas of analytics, security, technology, and digital and data transformation. This allows their clients to access high-level expertise without the commitment of a full-time hire. Welcome, Chris. So happy to be talking to you today.
Great. Thank you. I'm excited for our conversation.
Awesome. Let's jump right in.
Huh.
So I think, something in this world where there's a lot of differing opinions, I think one thing those of us in healthcare can agree on is that there are unlimited opportunities for improvements, right? Many of which can be best served by implementing technology. So I'm really excited to dive into this conversation today. We're at this interesting inflection point in healthcare tech where there are many, many different applications that are touting AI as their solution. And so what I'm hoping that we can talk about today is maybe clearing some of the noise and providing some clarity on what solutions are right for the problems that healthcare leaders are trying to solve. We've heard all of these different use cases for generative AI, many that are really complex in nature, such as clinical decision making, which is exciting. But today, I'd rather start by speaking about some of the less complicated use cases and think about where we can provide value by automating some of those frequent and repetitive tasks. So, Chris, can you give some insight into that?
Yeah, absolutely. I think you really hit it on the head here. Digital advancements have really significantly transformed the way that we communicate, interact, and conduct business, particularly in healthcare. And while AI has been around for a while, natural language processing and machine learning, many people are being exposed to AI for the first time. So naturally, there's some fear and uncertainty there. But in order for healthcare to really meet the healthcare demands, we have like the silver tsunami coming. We have people who are living longer. There's provider shortages. There's a real opportunity where we could see AI, not taking the place of people, but augmenting the healthcare workforce. And when many organizations look at their pain points, many of these areas are in operational or administrative tasks, right? So in this context, we really want to think about how AI can really be an opportunity to address these areas, right? So AI is a real opportunity to focus on, simple solutions, right? We don't need to overcomplicate things like, diagnosing patients or triaging patients or areas like that, and maybe that works to come down the pike. But I think in the immediate need, there's a real opportunity to address some of these operational tasks. Things that we can think about like outbound work, incoming work, right? Ways to just maximize these simple solutions for very time-consuming tasks for things like prior authorizations, right? AI has the potential to make adjustments in real time where you couldn't potentially do this kind of work, right? It may take months and months to make these adjustments on the fly, but AI can do that. And so AI also has the opportunity to really work and integrate in interoperable settings and into the EHR. I think of one way that we can really integrate AI is into call centers and into phone systems. These are areas that are heavily, burdened within organizations. There's a lot of incoming calls. There's patients who have long wait times, and in most organizations, they just can't really staff up the need in call centers. So, for example, if you integrate AI into your call system, your call tree, you could significantly reduce wait time for patients who are on the phone, right? We could almost make it a no-hold opportunity for patients where they can get the answers they need without having to sit in a queue. So that could significantly reduce the call volume and frustrations on the part of the staff and patients, where staff can really focus their energy on some of those more complex cases that they need. So, patients could get into the call, they can make appointments, they could get the answers that they need. on medication refills, for example. And the fabulous part about this too is that it can document all of this conversation and push this information directly into the patient's EHR, right? So you have all this note and this interaction between the patient and the AI documented in the chart, so the staff person doesn't have to go in and do that. There's also opportunities around preventative screening, right? I mean, we know that early detection can really greatly improve people's health outcomes. But it's hard to get people in for cancer screenings. And there's a variety of reasons for that. There's a variety of barriers for that. But this is really where I see AI as having an incredible amount of potential. We can look at these opportunities where maybe there's a campaign in place that an organization has, an email campaign or text campaign, and maybe that's been effective for some patients, but not effective for all patients. So you can look at the opportunities of having AI sort of be a follow-up there and interact with the patient to identify what some of those barriers might be. So it's really an exciting time. It's a wonderful opportunity to really think about how AI can really be both an ROI, like a return on investment, and also address many of those current challenges that organizations are facing.
Yeah, those use cases that you supplied, even thinking about in that more narrow scope of the things that we know are happening all day, every day in medical practices, or the opportunities that are missed because of staffing limitations. So I think those are all really great opportunities. When you think about even some of the outreach, components that you mentioned. Previously in another role, I had a team that did a lot of that outreach, and they did great work. But the challenge there's a number of challenges. Not that we're going to talk about all this today, but the ability to reach the patient at the time that works best for them. Right. If you're trying to do outreach to patients that are, busy working during the day, then, maybe when they're available, then the practice is closed. And so having an AI agent that could, be able to answer that call at any time. I think some of those things that really excite me, the concept of not having anyone waiting on hold, right? Anyone who's managed a call center knows the anxiety of seeing their call queue wait times, right?
Right. And it's one of the biggest pain points in many organizations. And, and many organizations just can't staff to the need in those areas. So a huge opportunity for AI to be a win-win all around.
Yeah, absolutely. So I read an article just recently that was a report that was released from Philips, and it was called the Future Health Index of 2024. And it was a really fascinating report because it was developed with the input of 3,000 healthcare leaders across 14 countries. So really a vast resource of, what are trends and what are people thinking about in healthcare. So interestingly, 85% of, not surprisingly, but interestingly, 85% of healthcare leaders commented that they were either already investing in or planning to invest in generative AI solutions to really provide some of those operational improvements, some of which we've just discussed, right? So one of the other things that the report really focused on was the financial pressures that are persistent related to those staff shortages, right? So it's a little bit like trying to fill a bucket that has a hole in it, right? The staffing challenges are really ongoing. And so, as you said earlier, it's not about replacing someone, it's about augmenting the staff that is available and providing them the ability to do the higher value work. So I'm interested in, thinking about, from your perspective, how do you think automation using some of these AI agent solutions can really deliver value at the practice level while addressing some of those rising cost challenges?
Yeah, I mean, it's really around these opportunities for delivering, we all are thinking about, value-based care, for example. And we want to make sure that, AI isn't contributing to any of these issues, right? So it's really about harnessing these opportunities to really improve patient outcomes and address some of these gaps and lower cost. And so, with AI, I mean, it's really an opportunity to sort of augment and grow the services. And many organizations, as we were saying, they just kind of can't staff to the level of need that in demand that's out there. However, AI can adjust, and it can adjust and grow on the fly. And, I think that's a really important piece of this new innovation that people are beginning to develop and grow. And, a lot of organizations are dealing with, and trying to meet value-based care, keep the costs low. And, there's just not possible to throw enough staff at that to sort of really address some of these areas. And meanwhile, healthcare is just continuing to get more and more complex. There's a need to, document information in the chart. So huge opportunities for AI to really sort of streamline some of these processes, retrieve data within organizations. Some of those biggest gaps are, we can sort of pinpoint some of those areas. For example, you're looking at some of the equity issues or biggest disparity issues that might be facing organizations, right? And how can we deliver and address some of those gaps? So I think this is where there's some of those biggest opportunities can really come, where AI can provide some of those efficiencies and really make healthcare more accessible to more people. And and that's how we really can sort of address some of these gaps in these patient populations. And we know that many AI products are often being developed at larger organizations, but it's also important to sort of think about how these AI products are also working within some smaller organizations, or for example, like we talked about the Philly Qualified Health Centers, right? There's about 1,400 of those across the country, and many of them are dealing with many diverse populations with many intersecting identities. And this is where I think it's a good opportunity to really address some of these gaps, and really see more opportunity to sort of lower some of those costs while seeing improved health outcomes as well.
Yeah, I couldn't agree more. Having come from a federally qualified health background myself, certainly there are so many different unique patient populations with different needs among them. And so, trying to staff to manage all of those is really a big challenge, even when it's really well intended. We were working on a project that we were going back to some of the STARS ratings that is around cancer screening. And so we're using this as one of the modalities, right? As human beings, we all have different preferences in terms of how do we want to be communicated to, right? Maybe I want someone to call me. Maybe I want to have a conversation. Maybe I want a text message. And so this is at this interesting intersection that it can, one, capture those preferences and then deliver based on the patient preferences. And so this cancer screening program is very exciting to me, because we are it's a research project, so I'm really excited to see some of the data that's captured from it. But also, we're doing some outbound calls to really help patients understand the value of screening and why it matters to them, especially if they're asymptomatic, right? We know that oftentimes that's a barrier to screening. But the agent can, walk through the steps, how to complete home screening, to, even some of the, really simple things. Did you actually receive the kit? We know that, updated addresses and other demographic information sometimes is the barrier in and of itself. But I think one of the interesting steps in the flow is, if the patient doesn't answer, we're going to trigger a text message that has a phone number embedded in the text message, allowing the patient to then call back and the time that works best for them, like we were talking about earlier, right? If maybe I'm not available now, but I'm available at 9 p.m., right? And the patient can then interact with the agent. So I think that that's a really exciting use case, and is really specific to some of those priority populations. But there's unlimited directions that could go in, and really understanding the unique needs of a population. I think we can really hone in on what are some of those common barriers or needs or preferences, right? So I think it's really exciting.
Yeah, I think we could incredible opportunity to even start to look at when people are responding to messages, right? Mm-hmm. So if you send a patient a text message and they don't, they look for some of those patterns. So maybe there's a particular time that a patient is available, and you could start to send your messages during those periods of time, right? You could really start to kind of hone in the AI and make it a much more personal experience. Even looking at, some examples of the higher need population, or, patients maybe with more social drivers of health, who really need more support. Are there ways that AI can really support some of these patients who maybe that need those extra touches, and need more support from the staff, or maybe the staff just, doesn't exist. There's not enough staff to sort of really support that work. And so, AI is an opportunity, like you said, to sort of really do some of those campaigns and kind of meet people where they are, right? This is really, I think, this is what excites me about this, is this real opportunity to really meet people where they are and sort of think about delivering this in a much more personalized experience for people. So that's the area that I really get excited about.
I agree. Those are concepts that we've been talking about in healthcare for a long time, meeting people where they are, and really that personalized care model. And sometimes it does work out well, but it's difficult to do at scale, right? So anyone in healthcare can even if that's your desire, it can be very challenging to do at scale. And we've already hit on the staffing shortages. We know that is at every level of the practice, right? From the frontline, staff that are supporting the providers all the way up through the providers. And so, being able to use tools to reduce some of that while still being able to deliver personalized care, I think is really very exciting. We were talking just recently about a project that was geared towards patients that for STD testing, and also for PrEP services. And so the interesting thing is we talked a lot about what are some of the barriers, right? And so sometimes it's just simply, I'm embarrassed as a patient about these questions, about this really sensitive topic. And we talked about, if I finally get up the nerve to call someone to ask a question, and now I'm sitting on hold for 10 minutes, maybe I lose my nerve, or maybe it's after hours, right? And so being able to reduce some of those barriers by deploying an AI agent that can answer some of those more sensitive questions that really could reduce some of those anxieties that the patient has, but still get the correct information when they need. There's not a better definition of meeting someone where they are, right? And so I think that's very, very exciting. So I wanted to get some perspective. You've held a lot of technology leadership roles, and so whenever we're talking about technology, especially new technologies like this, there's a lot of excitement and interest, but there's also uncertainty and concern. And so from your perspective and with that experience of the decisions that you have made in previous roles, how would you recommend that healthcare organizations, big or small, adopt these solutions responsibly? What does that look like?
Yeah, absolutely. So we all know that there are, challenges that exist in healthcare, and we don't want AI to exacerbate this issue, right? We want to think of the do no harm approach in healthcare. So it's really around building trust with individuals, right? And so this is basically a brand new, really, frontier for many organizations, and so it's really around thinking about how to put some guardrails in place. And I think many organizations haven't necessarily thought about that. And I think if they did an informal poll in their organization, they'd probably be surprised at how many people are using ChatGPT within the course of the job. And they probably would be surprised and hopefully horrified, right? Because we don't, ChatGPT retains a lot of that information, right? They use that to sort of train their models, right? And so as organizations are looking to develop tools, and I think what that just demonstrates is that staff want to use AI, right? They see it as a real benefit there. So it's important for organizations to really be thinking about having AI products that are specific to healthcare, that are keeping HIPAA at the forefront. So we're making sure that we're protecting data, right? Data privacy is so important within AI. Another way for organizations to really be addressing this issue is around putting policies in place to make sure that people are using AI responsibly, right? When to use it, when not to use it, right? How are they using it? What products are approved within the organization for that's safe for people to be using, right? And also, as organizations are working with vendors who are developing AI products, they want to make sure that they're getting them from reputable companies, right? We don't want to just kind of go out there and download any AI product. We want to make sure that these organizations, right, are safeguarding your data, or you're safeguarding your data within the context of AI. I think also any reputable organization will also talk about the algorithms that they use, the process that they go to validate them. So transparency is really important in this work, and making sure that the people that you're working with are using ethical frameworks that are really kind of looking at it from a 360 lens, and thinking about the potential negative and positive implications. Because we want to be transparent and upfront about some of the weaknesses that exist, so that those can be addressed. But really, we want to give employees the opportunity to use AI, but we also want to do it where we're using responsible vendors, right? You want to make sure that you're reviewing contracts and you understand what the agreements are on both sides. And lastly, I think it's also important for education with employees. I mean, again, it's a new frontier, and many people are learning about AI through lots of different ways. And just like anything, there's some good information out there and some bad information out there. And I think organizations, should probably take this on and work to really educate their employees around responsible use of AI, valid products, but also give an opportunity to really benefit from some of these products as well.
Yeah, those are all really great tips, and I think very applicable tips, right? When you're trying to analyze what is a solution that's going to be good for your practice. And so, we've talked about a lot of different areas where there's benefits to AI, and some of the more simple problems that it's addressing and helping to solve for today. And so, there's unlimited different directions that it's going in every day, right? Every day we're hearing different applications and use cases. And so I'm hoping that, through our discussion today, that this is helpful for leaders that are trying to sift through that and make sense of some of that, and what are some of the things they should be asking partners, or thinking about internally, what questions they should be discussing to make some of those decisions. So as we wrap up our conversation today, I do have one final question. We often hear about programs like this at large health systems. So from your perspective, having worked in different healthcare settings through the years, what kind of practice do you think should be considering a solution for even some of the use cases that we've talked about today, some of those operational benefits or patient-centered benefits?
Yeah, I think it's an excellent question, Lisa, because I think there's a sort of misnomer out there that AI is only for bigger organizations. Mm-hmm. And, the approach is really about thinking about AI as a problem solver. It's not only for large organizations with deep pockets or lots of resources, right? It's for any organizations. And I think if you do a poll of most executives, most executives of smaller organizations likewise are thinking about, revenue issues and budget issues and staff burnout. And so these solutions are primed to deal with that, particularly in smaller organizations. And you don't need a large IT department, informatics department to roll out these solutions. They don't need tons of care and feeding to make them effective. They're often leaner, smaller, don't have lots of staffing and resources. And this is really where AI can augment the staff. And so again, it's not about replacing people, but it's really about augmenting staffing and sort of filling in some of those gaps and some of those tasks that are incredibly time consuming, but are important, right, in getting patients connected to care. And so, this is really where AI has an incredible benefit to that. We've mentioned a few times federally qualified health centers who are caring for some of the most vulnerable population that I think they're completely primed to benefit from AI, right? And this gives them also the opportunity to really level the playing field with larger organizations. And we talked about this a few times, but for example, oftentimes they're caring for, very vulnerable populations, or maybe they're located in parts of the country where patients are more rural areas. And so, really being able to sort of address that and also develop AI to have some of those personalized messages, or maybe prevent somebody from driving, literally hundreds of miles to an appointment, right? I mean, we take that for granted when we're like in a larger city, but also in a larger city, I mean, it could take hours to get across town. I mean, that's kind of like what it is like here in Boston, right? And that's, and that's often, a gap or a barrier for people to access care. But I think these are incredible opportunities to close the gaps and really make it more accessible for all organizations. These are not exorbitantly costly products, right? And it doesn't take a PhD person to manage them and roll them out and fine tune them. And I think the key is really to look for those partners that are really committed to working with smaller organizations and who have vetted their products and rolled them out and really understand some of the challenges that are facing many organizations. And so I think there's a opportunity around value-based care, which is very much on the mind of many smaller organizations. And for example, sometimes patients will get assigned to a provider, and maybe they haven't showed up ever for a visit, but you're still on the hook, right, for that patient's care. So perfect example how you can use AI in those situations to reach out to patients to see if they still intend to get care within your organization, and if not, have them reassigned to the appropriate provider, right? So incredible amounts of opportunity, and that kind of work takes so much time and so much effort, right? And for staff. So I mean, I can kind of go on and on. We've already talked about the inbound calls, right, and outbound calls, and many of the demands that, for example, private health centers have to meet, right, in terms of collecting data and how AI can, assist in that, collecting data, make sure data is documented, and if it's not collected on our patient, can the AI agent kind of have an interaction with the patient to collect those data? I mean, just really, I mean, it just, we started to talk about this, we start to think about so many incredible opportunities that exist out there. And I'm excited because I actually think it's really a perfect product for some of the smaller organizations that exist.
Yeah, I absolutely agree. And that's why I always love having a conversation with you, because I think because you are always, so leading edge in terms of what's coming and how to best implement it in the healthcare system, in the healthcare industry. So I appreciate your time today. I appreciate your insight. And like I said, I hope this is useful for anyone who's trying to navigate the field and make a selection for the best AI solution for the problem they're trying to solve. So thanks so much, Chris, for your time and your expertise.
Great. Thanks so much for the wonderful conversation today.